So I chose to do my presentation on the use of tobacco. The lesson objectives are to be aware of how the use of these products impact health, understand the basic knowledge of tobacco and nicotine, and be able to identify the problems with using these products. So the toxins in tobacco smoke. What many people don't realize is how many chemicals tobacco smoke contain. Not only does it contain chemicals, but it also contains poisonous gases as well, all of which are going into your body at once. An example of these chemicals would be nicotine, formaldehyde, lead arsenic, uranium. The poisonous gases would be carbon monoxide, hydrogen cyanide, ammonia, and butane. All of these are just some examples. There are a lot more chemicals that actually are in cigarette smoke. So, how does tobacco use affect health? Well, it increases your risk for coronary heart disease and stroke. It increases your risk for cancers such as bladder, blood, cervix, colon, oropharynx, and many more. It can create pregnancy complications such as premature birth, stillbirth, low birth weight, and it also lowers sperm count. It can cause gum disease and tooth loss. It can increase risk for cataracts, increase risk for type 2 diabetes, increases your risk for lung disease, and many more. If you look to the right, you'll see an image that basically is depicting the risks from smoking between cancers and chronic disease. Basically, it's showing you that smoking and tobacco use doesn't just affect your lungs, it can affect your entire body. And you can also see that the list for the diseases and the cancers is extremely long. So, how does tobacco use lead to addiction? Well, the tobacco leaf itself isn't addictive, but it contains an addictive agent, which is called nicotine. Beginning to smoke at a young age increases your risks of becoming extremely addicted. Addiction is an impulsive need for a substance, even if there is knowledge that the substance is harmful. This basically means that the need for the substance becomes very strong, so even if the individual wants to stop, it's going to be extremely difficult for them to. This substance, known as nicotine, causes chemical changes in your brain, which cause you to become highly addicted. There are also more than 10 milligrams of nicotine in each cigarette. So every time you smoke, you're not only ingesting millions of chemicals, but you're also inhaling 10 milligrams of nicotine, if not more. So if you think about it, you're inhaling multiple deadly substances. So how exactly does one get treated for a nicotine addiction? Well, treatments are extremely specific to the individual person. Each person is different, so one thing may work for someone, but it won't quite work for somebody else. That's why there are many different options to treat a nicotine addiction. Some examples of these treatments are behavioral treatments. These aim to point out risks of smoking, nicotine use, and tobacco. They are self-helping, and you can also seek counseling. Another option would be nicotine replacement. These are FDA-approved products such as chewing gum, transdermal patches, nasal spray, and inhalers. There are also other medications offered. These target brain receptors, so basically they're stopping the nicotine addiction by stopping brain chemicals. These are all prescribed by a doctor, so if you do want to seek these out as a treatment, you have to go see your PCP or someone who is licensed to prescribe these. So now I have a few questions for you guys. The first one would be, what is the addictive agent in tobacco? A, nicotine, B, barbiturates, C, opioid, or D, sedatives? The answer is A, nicotine. My next question is, on average, how many milligrams of nicotine are in one cigarette? A, 15 milligrams, B, 5 milligrams, C, 10 milligrams, or D, 20 milligrams? The answer is C, 10 milligrams. So for my last question, I switched it up a little bit. It's a true or false question. So true or false? Medication to treat a nicotine addiction must be prescribed by a doctor. The answer is true. And these are my references. Thank you all for watching.